It's incredibly complicated. And what they're facing is that often to end a pregnancy, they have to wait until a pregnant person's life is at risk to anybody that would walk in the room. They're having to talk to their hospital lawyers before they can make a medical decision. And often they're having to say to patients, I can't do this until you are very sick. And that just makes the patients and the providers feel helpless. A really classic example that I've heard from several friends about: a patient comes in bleeding from a placenta that covers their birth canal. And if they're 18, 19, 20 weeks and they're bleeding heavily, their life is at risk. But they have to wait until that patient is truly almost in need of an ICU bed and at clear risk of dying, rather than doing something before that patient needs to drain the blood bank, before that patient needs an ICU bed, before that patient needs to be intubated. It's just really terrifying to think through.
What else can happen to that patient if doctors have no choice but to wait?
They can die. And it's just a matter of days before we start to see reports in the news of patients that have died because they couldn't get access to abortion.